This is the official video summary of the pivotal side event at the 4th International Conference on Public Health in Africa, CPHIA 2025.
Good evening again and welcome. On behalf of the African Health Catalyst Forum and Africa CDC, we welcome you to this special side event.
A crucial meeting that builds on the foundation laid by the roadmap to self-reliant healthcare roundtables co-hosted by Africa CDC and the African Health Catalyst Forum. Moderator Edward Oladele set the stage.
We have about a $12 billion shortfall, funding gap that is staring us in the face as a continent. Now is the time more than ever to ensure that we leverage our own strengths.
The context is urgent. Africa faces a funding crisis defined by a projected 70% decline in external aid, creating an immediate risk to the new public health order. This challenge, coupled with changing demography and emerging diseases, means the era of dependence is over. African nations must now achieve financial self-reliance. The event focused on 4 main topics: leveraging diaspora financial and intellectual capital, fostering private sector innovation for quality care, addressing the trust deficit and fragmentation, and establishing mechanisms for Afro-pragmatism and self-resource mobilization. Addressing this requires a paradigm shift towards financial sovereignty. Nadia Yakelef of Africa CDC powerfully framed this transformation.
In the year ahead, the question will not be what did Africa lose when aid declined, but rather what did Africa build when it decided to invest in its own health.
The core systemic barrier is one of connection, not capital. Jacques Mwende underscored this point.
There's no problem of capital. The problem of connection. The funds are there. It's not a problem of money which is lacking. It's a problem of connection. How to connect private sector, diaspora with the government. How to connect. That's the issue.
Dr. Maurice Atoki highlighted the required change in mindset for engagement.
While the so-called aid is happening, it's also for Africa to prepare itself and to fortify itself just in case the aid diminishes.
The discussion explored the dual role of the diaspora as a donor, investor, health innovator, and crucially, as a consumer demanding quality. Dr. Serge Alain Wanji spoke on the diaspora's market power.
60% of Africans in the state of Minnesota work in healthcare. Picture that. 60% of Africans. Right? This is significant.
Audience input was crucial. Otto Chabikali's challenge centered on the core nature of remittances.
Let's us be real and agree. How did we come to this point of fragmentation? And I think it is trust deficits, let's face it. Many people in diaspora that will speak with, they will say, we collected money and somebody ran away with the money. So how do I trust that if we start pooling together this time around, they're going to be lucky?
Key outputs. The event established a strong consensus on 3 strategic outputs. First, diaspora remittances must be viewed as strategic investments. Second, governments must prioritize de-risking investments and fostering transparency. And third, institutional durability, pragmatic thinking, and adaptive policy are essential for transformation. Next steps. The key commitment is the establishment of an inclusive working group. This multi-sectoral reflection group, co-led by Africa CDC and the African Health Catalyst Forum, and crucially including ministries of finance, is tasked with designing the platform architecture. This commitment marks a concrete step towards financial self-resource mobilization and realizing the Durban promise. By channeling our own capital and expertise, we are building a truly resilient health future for Africa.